Okay, what happened is that I knew I needed dental work, and I kept putting it off, brushing my teeth, and one of my tooth fell out. One of the anchor teeth because I had a small bridge at the bottom, and I said, okay, I think it's really time for me to go to the dentist now. So I did some research because basically I'm a chicken at heart, and I wanted implants, so I figured let me do some research, and I came up with Sedation Dental. And I said, oh, this sounds good. I read the bio, and I said, okay. So I called the office, and I wanted to consult with Dr. Dan. So I did. So I spent about a half hour with Dr. Dan consulting, explaining the procedure and everything else for me. So I said, okay, I'm gonna do it. And then at the last minute also, I decided to get a new upper. Because I had an upper because when I had a stroke back in '97, for some reason the medication that I was on loosened my teeth. So I had a denture and I knew I was due for a new one. I figured, well, if I'm gonna get the implants at the bottom, I might as well get matching up front. So, man, I worked with Kathy for the financing and everything else. When the time came, he explained to me, well, you take a pill an hour before you come here. And of course, my wife drove me, and my wife told me that I fell asleep in the waiting room here, which I don't recall. The only thing I really recall is going into the chair in the office, putting an IV in my hand, and next thing after that, I remember wheeling me out in a wheelchair. So to me, and I told Dr. Dan, and he said, well, that's a good visit. I said, you're absolutely right. That's a good visit. I went home, he gave me a prescription for pain pills. I think I took 2 of them, and I slept, I was still out of it, but later in the day, I laid in bed, went to sleep that night. I woke up, I think I took another pain pill, and the next morning I was basically fine, a little groggy, but I stayed in the house and just relaxed. So I had the implants, the snap in, I guess, about a couple of weeks ago. And before I had them snapped in, I had to use the Fix-A-Dent on them to have them so I could eat. And I came back here, and Amanda, she did most of the adjusting for the bottom and also for the top, where they were irritating my gums. And we finally got the top right and also the bottom before I went to New York. And I've been back once now for the bottom adjustment, and most likely once or twice more I'm gonna need it. And I spoke to Dr. Dan, as a matter of fact, today, and he said that he'll be able to look at it, and it's much better than it was when I first came about a week after he put the snaps in. It just relaxes me, and because I don't like pain. I have a very low tolerance for pain, and to me it works. Okay. It works. I don't get really anxious about coming to the dentist anymore. As I say, everybody I dealt with here has always been very friendly. And it's the first time too that I experienced to get measured for my upper, where they use the TINS machine on you to relax all your muscles, so to get a true fit, But yes, I would definitely recommend Dr. Dan.